The holiday decorations are coming down. There's no longer an endless supply of cookies and chocolate in my kitchen. It's basically that time of year when I like to treat myself to a little something special, or maybe a few little somethings special, which is where Quince comes in. Because Quince partners directly with manufacturers, they're able to pass their savings on to you. So you can get luxurious clothing and accessories at prices that are 50 to 80% less than similar brands. Now, I've got my eye on a couple of things that I think will go a long way toward brightening my winter mood. One is a dolman sleeve cashmere sweater that's priced at just under $40. And the other is a lightweight puffer jacket that's just $79.90 that I plan to take with me for some hiking in Sedona in a few weeks. Treat yourself this winter without the luxury price tag. Go to quince.com/nursemo for 365-day returns plus free shipping on your order. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast where I teach concepts and share tips on how to thrive in school and at the bedside. And today we're going to be talking through 6 common sources or reasons for anxiety in nursing school. Now, before we jump into that, let's take a quick minute for our listener shout out. And this shout out goes out to Katie, who says, "Shouting out for Nurse Mo's podcast. This helped get me through countless exams and quizzes with crucial concepts. I just passed my boards and accepted my first job in a pediatric ICU." Well, way to go, Katie. I'm so happy for you that you landed such a cool job and that the podcast helped you understand all those crucial concepts to help you get through your exams and your quizzes and, of course, your boards. So thanks again for being a podcast listener, and I want to wish you the very best of luck in your career as a pediatric ICU nurse. So today we're talking about 6 common sources for nursing school anxiety. And you might be wondering, wow, that's a lot of sources, and why is nursing school anxiety such a big deal? Here's the thing. If you've already started nursing school, you already know this, right? You know that anxiety or stress or worry about school is just, it seems to kind of always be there and a part of everything that you're doing. And if you're not in it yet, I will just tell you that nursing school is an intense environment. And it has a lot of these high stakes events and assessments that happen pretty much almost daily. And what this usually means is that students have multiple sources of anxiety, which can, if it's left unchecked, it can lead to feelings of stress, feelings of being very overwhelmed. It can even lead to depression and burnout. Now, the good news is that once you recognize these sources and have a plan to meet them head on, you can lower your nursing school anxiety and maybe even start to enjoy your nursing school program. So the key sources of anxiety for nursing students are math anxiety, test anxiety, anxiety about clinical, anxiety in skills lab and with skills checkoffs, sim lab anxiety, and workload anxiety. So we'll start by talking about math anxiety. So math anxiety is defined as a feeling of tension or fear or apprehension that interferes with your ability to perform math calculations. And unfortunately, this feeling uses up a lot of your working memory, that processing capacity, making it very, very difficult to think through the math problems. And the reason math anxiety is of very real concern in nursing school is because of the nursing math exam that every student has to pass, most likely every semester, if not definitely at the very beginning of the nursing program early on. And this exam is going to look at your ability to solve dosage calculations. And in most cases, the grade you have to get on this exam is pretty high. Lots of times it's 90%, but I've also seen even higher, 95%, even 100%. So, for example, if you're not sure what I mean by a dosage calculation question, you might be faced with a situation where you have an order to administer 0.2 milligrams per kilogram of a medication for your patient who weighs, let's say, 98 pounds. The medication comes in a 10 ml vial containing 20 milligrams of medication. And so what you need to do to figure out this calculation is figure out how many mils of medication you're going to administer. So that's an example of a dosage calculation question. So the first thing I want you to know is good news, you are not the only one with math anxiety. I definitely don't want you to think that you are. You 100% are not alone. In fact, studies show that 93% of adults experience some level of math anxiety, and 1 in 5 adults in the United States report experiencing severe math anxiety. And to make you feel even better, emerging research shows that students with math anxiety are actually average to high math performers. In other words, having math anxiety does not mean you're bad at math or incapable of learning how to solve dosage calculations with total and complete accuracy, okay? So you can get that out of your head right now. Take a breath. You're going to be okay. Now, how do we combat math anxiety in nursing school? Now, the first thing I want you to do, if you have math anxiety, is reframe how you talk to yourself about math. Instead of saying, I'm bad at math, or I'm going to fail this exam, think of how you can shift that to instead say something that's more positive, but also true. This is the kicker. It has to be also true. I wouldn't say, if my former thought was, I'm bad at math, I wouldn't just flip that and say, I'm a math genius, because that's not true. It has to be believable. So how about saying instead, I am practicing math and feeling more confident every day. That's a statement you can get behind and feel that is true. Or maybe, I am open to learning how to do math without fear. That is something that you can believe, and it's way more productive of a thought than, I'm bad at this, or I'm going to fail this exam, right? So reframe how you talk to yourself. Next, it's really vital that you break the math cycle of failure. And I talk about this a lot in another episode that I recorded that dives really deep into math anxiety. I will put a link to that in the episode notes if you want to get a little bit more of a feel for this math cycle of failure. But generally, what this involves is practicing regularly. So practicing your math skills. And what this does is it leads to you having a more positive math experience. So when you have that positive math experience, you now have positive feelings associated with math, and you break that math cycle of failure. And if you're not sure even like where to start with this, I've got you. I have a guide that I made called the Dosage Calculations Guide, and it includes some information on how to set up dosage calculations questions, how to go about solving them, and 10 practice questions. Now, this guide is completely free. I'd love for you to get it. I will put a link in the episode notes so that you can get your hands on that. Okay, so that was math anxiety. You definitely can conquer that. I had severe math anxiety, and now I teach math. So there you go. If that's not a great testimonial, then I don't know what is. So the next type of anxiety we're talking about is test anxiety. And this is very closely related to math anxiety. What I want you to know about test anxiety is that it's most likely going to be that no one is immune to this. Even the most prepared student can start to feel some test anxiety, could even start to panic during an exam. But it's what you do next that really determines if test anxiety is going to completely take over and derail your test performance. So, the key with test anxiety, beyond preparing well, of course, being prepared does help quite a bit. But the key when you're in that exam or about to start that exam is to recognize it. You want to recognize it for what it is as soon as those feelings start to creep in. This could be a rapid heart rate that you might notice, sweaty hands, a feeling of dread in some cases. Maybe you notice that you're continually checking the clock to see how much time you have left. For some people, that can be a cause of anxiety to be watching the clock, but also a sign that they're experiencing anxiety. You might feel a rush of adrenaline or that sick feeling in your stomach, or even have tremors. And in some cases, reduced comprehension. So let's say you're taking an exam and you find that you've had to read the question 3 times, but you're still not focusing in on what it's asking. You're experiencing some test anxiety. Now, the highlights about dealing with test anxiety are: the first thing, after you recognize that it's happening, is you got to pause. I know you're taking a timed exam, but if you don't pause now, you are on a path to completely coming off the rails with this anxiety. So take a pause and take a few breaths. Really deep in all the way, slow exhale out. Do that 3 times, 5 times until you feel your heart rate come down, that sense of dread start to dissipate, and your mind start to clear. Okay? Then I want you to quickly reframe your negative self-talk, because something that happens as you're in a test and you're starting to spiral is you start saying those things, right? Like, oh my gosh, I'm going to fail. Oh my goodness, I'm running out of time. I have no idea what this question is talking about. All these really negative statements. So just like with the math anxiety reframing, do a quick reframe here and have your reframed statement ready so you're not trying to come up with one in the moment. And that might be something like, I've studied and I'm prepared for this exam. Something like that. Whatever it is for you, think of something that you can utilize that will be believable and that you can grasp onto when you notice that negative self-talk happening. And then you've got all this energy, right? All this adrenaline and pent-up energy in your body. You've got to release that tension. So you can tense and release those tight muscles, really focusing in on your neck, your shoulders, your upper back, your arms, your hands, your face, like really focusing in on those parts of you. Tense and release, consciously relax them. Then you can restart your test with clarity, with calmness, and with intention. And what I mean by that is, as you go to the next question, you're not going to speed through it and start getting your anxiety going again. You're going to slow down and read each and every word of the question so that you fully understand what it's asking. And then read each and every word of the answers so that you don't gloss over an important detail and accidentally choose the wrong one. So those are the highlights of dealing with test anxiety. Recognize it, pause and take deep breaths, reframe your negative self-talk, release the tension, resume with clarity and intention, and slow down and read every word. Now, I do go into this in a little bit more detail in another episode, which I will link to in the episode notes. Now, the next kind of anxiety I mentioned is anxiety about clinicals. Now, I'm a clinical instructor right now as I'm recording this, and I have seen firsthand how this clinical environment causes anxiety in students, especially first semester students. Now, the first thing I want you to know is that this is pretty much expected. You are in an entirely new environment, interacting with real people, patients basically, that you've never met before, and now you got to get up all in their business and do stuff. And I want to say that if you're feeling anxious in clinical, I'm kind of glad for you. It's actually a good thing that you are a bit nervous here. It means that you truly do understand the importance of what you're learning and what you're doing. And this can help make you a careful and conscientious nurse. But when anxiety becomes too intense, it becomes counterproductive and it can hinder your performance. So let's talk about some tactics that you can use to lessen your clinical anxiety. First off, you gotta be prepared. Now, I realize that this is not always in your control. So, for example, some clinical sites allow students to come in the day before to select their patients, which means you've got plenty of time to go home and look up their specific disease conditions and all their medications and really understand why different things have been ordered for this patient. But more and more clinical sites are stopping this practice. So students simply show up on the day of their clinical, get their patient assignment first thing in the morning, and then have to kind of figure it out as they go. And this can be especially nerve-wracking for new students who, A, have limited knowledge and aren't used to caring for patients. So another reason this is tricky, I said limited knowledge, is because let's say you are in week 3 of your program, and so far you've learned about oxygen and respiratory conditions and what else? Maybe a little bit of neuro, okay? But then you go into clinical and you've got a patient with a GI issue. Well, you haven't learned GI stuff in class yet, but you have to be able to know enough to effectively take care of this patient. So there's a little bit of a disconnect there when things don't completely line up. So even if you aren't in a situation where you can go in and select your patient ahead of time and have all of that evening before clinical to look up that patient's past medical history and understand the pathophysiology, you can still go into clinical prepared. So here's what I would suggest. First off, you should know what units you're going to be on in advance. If you're going to be on a neuro unit or an ortho unit or a general surgical unit or medical unit, whatever it is, you should know what that is in advance. So take a little bit of time to brush up on key medical conditions you might see on that type of unit, as well as some common medications that might be utilized. So let's say you are assigned to a neuro unit. So it might be smart to just brush up on caring for patients after a stroke before you go onto that unit, and looking at common medications utilized after a stroke. Maybe the patients often get things like antiplatelet medications, in some cases, anti-seizure medications. So brushing up on those. If you're going to an ortho unit, for example, review the post-op care of surgical patients. Look up hip replacement, knee replacement, get a feel for what that looks like when you are caring for a patient with that condition, so that when you actually walk in the room and you're like, oh, Bob had his knee done, had his knee replaced. I kind of know a little bit about this because I read up on it last night or last week or whatever it is. And then common medications you might see on an ortho unit are going to be things like antibiotics, pain medications, and anticoagulants. So I know that might sound like a lot, and I know you don't have a ton of time to be not only studying what you're learning in class because you're going to have an exam on it in a week, but then going and reading ahead, like that's hard, right? And I get that. Chances are you don't have time for that. So what I would suggest is check to see if this podcast has talked about that particular disease condition. I probably have talked about all kinds of things related to neuro and, medical conditions and all of that. So go to the website, use the search bar, find some related stuff and listen to it. I'm not saying you have to make it your life's work. Put it on the background. So that way, when you walk into clinical, it's not the very, very, very first time you're hearing the term cholecystitis, okay? You can also check out my program Med Surg Solution if you like a more structured approach. where I provide video tutorials and downloadable study guides on about 60 disease conditions that are common things that you will see in the clinical setting. So there's a couple options for you if you want to just hit the highlights before you head into clinical. So being prepared. The next way that you can lessen your clinical anxiety is to plan your day. Take a moment at the start of your shift to get familiar with your patient. A great place to start is by reading the most recent physician progress note and the most recent end of shift nursing summary. It's also important to look at their active orders and any medications that have been prescribed for them. And this can really give you an overview of their problems and the things that are being done to address them. So you will use this data to plan your day. So for example, let's say that you see your patient has orders to be out of bed for meals. Well, guess what that means? That means you need to plan some time in your day to get that patient up out of bed and sitting in the chair before those meal trays arrive. And depending on what's going on with the patient, this can be a little bit of a process. So you want to make sure you have that planned out. If they need blood glucose checks, you want to write those down on your little schedule, your plan for the day. Other things to plan in advance include routine tasks like repositioning, oral care, and dressing changes. Now, one quick note about plans is that even the very best ones can sometimes fly out the window when unexpected things happen. And guess what? Patients are dynamic. Unexpected things happen all the time. So I want you to know, even though you've got your plan, something unexpected is likely going to come along and mess it up. But you know what? Once you get through that unexpected event, you have a map to bring you back to get on track. So just know your plan might fly out the window, but you can reassess your patient, get your priorities reassigned, and get back on track with your plan. Another thing I will advise if you are feeling especially anxious about clinical is be open about it and share your concerns. You want to share these with the nurse that you're working with. Let's say you are really nervous about doing a skill for the first time. Let the nurse know, hey, this is my first time doing a dressing change. Do you mind observing and coaching me as I go through it? Or should we talk through this before I go in the room? You can also share your concerns with your clinical instructor. We have all been there. We've all been first semester nursing students. We've all been anxious or nervous about something, and we want to be there for you and help you see through your fear to approach new situations with more confidence. Remember, everybody involved wants you to succeed. Alrighty, the next type of anxiety is skills lab anxiety. But let's take a quick break before we hop into that.
We're so done with New Year, New You. This year, it's more you on Bumble. More of you shamelessly sending playlists, especially that one filled with show tunes. More of you finding Geminis because you know you always like them. More of you dating with intention because you know what you want. And you know what? We love that for you. Someone else will too. Be more you this year and find them on Bumble.
Alrighty, so let's talk about anxiety related to Skills Lab. Skills Lab is actually really fun and a really engaging environment where you're basically learning how to do all that hands-on stuff like inserting nasogastric tubes or giving meds or changing dressings, bathing your patient, inserting Foley catheters, all those kinds of things. And a few of those key skills are going to require something called a checkoff. And these checkoffs can be anxiety producing simply because they are high stakes assessments. In most programs, you'll get 2 to 3 attempts to perform these high stakes assessments or checkoffs. And then if you don't pass, you essentially fail the class. So we don't want that, right? And because the stakes are high, students can be really nervous and have some anxiety. So the program I attended, skills checkoffs were conducted for things like taking vital signs, conducting a head-to-toe assessment, inserting a Foley catheter and doing that whole sterile field situation, and of course, administering medications. There may have been a couple others. Those are the key ones that I remember. Now, the key to handling skills lab anxiety is, guess what? Prepare, prepare, and then prepare some more. This means practicing the skill you're being evaluated on over and over again. So if your school has open skills lab where you can go in, get your hands on the equipment and practice, take advantage of that. You can also print off the skills checklist. So your school should provide a checklist. Here's the criteria for passing this check off so that you can study. Obviously, you're going to review the heck out of that list, but don't just read it. You want to go through the motions and do all the things. So take that list, give it to a family member, give it to a classmate and say, I'm going to go through this skill and I need you to make sure I'm doing everything on this list. And if I don't, I need you to call me out on it so I remember to add it into my practice. And that's a great way. You could also videotape yourself doing the skill and then watch it back to evaluate yourself. All kinds of things you can do to practice and prepare for a skills checkoff. Okay? Now, the next type of anxiety is SimLab. So a lot of times these are kind of similar, SimLab and skills checkoff. I've actually got an episode where I talk about both, and I'll link to that in the episode notes. So SimLab is another source of potential anxiety in nursing school. And if you don't know what SimLab is, it's a simulated scenario with a simulated patient who's having some kind of problem, and you come into the room and you have to figure out what's going on and how best to intervene. So that sounds kind of scary, right? Especially when you're new. And students often have fear that they're going to look like they don't know what they're doing in front of their peers and in front of their professors, people you definitely value, right? People whose opinion you definitely value. There's also the fear of doing the wrong thing and accidentally harming your simulated patient. These are definite valid concerns, but with the right preparation and the right attitude, you can turn this kind of scary, anxiety-producing experience into a fabulous and, dare I say, fun learning opportunity. So the key to doing well and feeling confident in SimLab is, of course, again, to prepare. You should know in advance what the overall theme of the lab is going to be. But if you don't, here is a hint. If you are learning respiratory in class and you've got a sim lab that week, guess what? It's probably going to be respiratory related. So take a look at what is currently being covered in your med surg class, what's coming up on the next exam. Those types of things are fair game for your simulated patient. So take a little time to review your notes before you walk into the lab, and you will definitely feel a ton more confidence. Now, the other factor in feeling less anxious in simulation lab is basically knowing what to do. And this, my friend, is actually very easy. You're just going to follow the nursing process. And what does it always start with? It starts with assessment. And even before assessing is noticing, like noticing something's not right with my patient. So noticing something is wrong and then diving into the nursing process, which begins with assessment. So if you're in SimLab and you ever don't know what to do, assess your patient, okay? Now, I did talk about this in more detail in another episode, which I will link to in the episode notes. All right, now let's dive into the final factor of anxiety in nursing school, and that is anxiety about the workload. And that's because nursing school is very busy and there's a lot going on. Your very, very best defenses against workload anxiety are to get supremely organized and use some kind of planning system to manage your time. Now, I do go into this in absolute stunning detail in my nursing school prep course, Crucial Concepts Bootcamp. I'm going to share a few highlights with you here. Okay, so number one, take some time before the semester begins to get your digital filing system organized, like set up a system and a framework for that. You want to get all your nursing school paperwork organized as well. I cannot stress enough how beneficial this is and how much time it will save you. Number two, take some time to dive into your school's learning management system and navigate around and figure out how it works and see what all resources are there available for you and where things are located. This will also save you a ton of time. I also advise using some kind of planning system. I especially like the type that allows you to make lists because lists will be your friend as you check things off and allows you to block out time. I'm a huge fan of a paper planning system with a monthly and weekly view, but if you can achieve this with your Google Calendar or your Apple Calendar, then by all means continue using that if that is how you roll. The next thing, and this is more of a mindset about managing the workload, is to be very, very, very protective of your time. Time will be absolutely your most crucial and important asset in nursing school. And this means identifying and removing time wasters and minimizing distractions. In many cases, this might mean avoiding large study groups, removing apps from your phone that distract you. Okay, I'm super guilty of that. Maybe setting up a site blocker on your main computer so that when you start a work session, you turn on your site blocker and it won't let you go check out TikTok or whatever. Or shop or whatever it is, whatever sites you deem are your specific time wasters and that you want to block. And another thing I suggest is setting up a designated study space. Not only does this minimize distractions, but I find that having a designated study space kind of signals to your brain that when I am in this space, it is time to focus and work. That's why I'm not a huge fan of studying while you're lounging in bed or on the couch. Yes, it's nice to switch things up once in a while, but I probably wouldn't do my most critical studying in an environment that is not my workspace. I might save that for when I need to do a light review. Yes, I have been known to sit out by the pool while I am reviewing notes. That's fine, but if you're really trying to learn and study, then try to use a designated study space for that. And then another way you could protect your time and lower anxiety is to avoid overstudying. This is a huge time waster for students, and I think a lot of students maybe don't realize they're overstudying or don't think there is any such thing as overstudying. But if you are studying, reviewing your notes, and you find that you're reviewing stuff you already know, or you're not having these like regular moments of say, what? I need to review that. I need to light up my brain and investigate this further. Like if you're not having those moments, you're likely either very disengaged and tired and need to take a break, or you're reviewing material you already know. It's time to stop and move on to something else, or just stop and be done for the day. Okay. So avoiding overstudying. So I hope these tips on recognizing and managing nursing school anxiety, the different sources and types, help you feel less stress as you're heading into your program or heading back into another semester, and definitely hoping that you're feeling more confident. Now, again, I did mention some other episodes where I've dove into each of these a bit more deeply. I've got those linked in the episode notes, which you can access from your podcast player. And I will see you back here very soon to talk about right-sided heart failure. So make sure you're following the show so you don't miss that episode or any others. See you soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.